Hello friends, I'm Dr. Vijay Pillai, Consultant and Chief of Head and Neck Surgical Oncology at Narayana Health, Bangalore. Now, oral cancer can be prevented and prevention is the best form of cure. How do you prevent oral cancer? One is make sure that you abstain from all the causative agents like what we mentioned, tobacco, alcohol, have a healthy diet, eat good amounts of healthy nutritious foods, green leafy vegetables, good health exercises, good resting factors. These all would definitely prevent any form of cancer. But more importantly, when we look at oral cancer specifically, there is a natural way in which it progresses. It starts off with a white patch in the mouth, it then progresses onto a red patch, it goes on to an ulcer which doesn't heal. Remember, friends, whenever you see any of these signs, don't brush it off as just any other ulcer or a white patch. Seek a consultation with a specialist. For all you know, that must be one of the earliest signs. We do not want it to be missed. We see patients who miss most of these early signs and then come to us with very advanced form of cancers. They would have just said that it's probably a small burning sensation, which they would have used some sort of medicine, some sort of gels just to overcome it. And unfortunately, when they present to a specialist, it would have already progressed. Remember, prevention is the best form of cure. Early detection also helps in curing. Now, when we talk about the diagnosis of oral cancer, the first thing is a clinical examination. So, when you visit a specialist, it would be a head and neck specialist or probably an ENT surgeon. The first thing that the doctor would do is examine your mouth. He would just examine it using a mirror and a light. He may want to do an endoscopy. That means he would just put a camera to see the back of the throat, to see the upper part of the voice box, the foot pipe. Also, probably he would want to examine the nose and the back of the nose. Now, if the person sees that there is something which is abnormal, some sort of concern, he may want to do a few additional tests. So, these additional tests would be probably some sort of scans. There are a variety of scans which are recommended. It can be just an ultrasound of the neck, it can be a CT scan, it can be an MRI, or it can be a whole body scan called as a PET CT scan. Now, the choice of scan is basically decided by the signs and symptoms and by the specialist who has examined you. In addition to diagnose the problem that you are facing, he would want to have a small amount of tissue sent from that area for a microscopic diagnosis. This is what's referred to as a biopsy. If not a biopsy, they may want to sample a few cells from swellings in the neck, which are known as lymph nodes, and that is what is known as an FNAC or a cytology. So, to put it together, there would be a clinical examination, there would be a few scans, and there would be a little bit of tissue diagnosis, which would help the clinician come to a diagnosis to what exactly is the problem that you're facing. Now, over the period of years, the head and neck cancer treatment has evolved to involve multiple specialties. So, the treatment involves surgery, it involves radiation, it involves chemotherapy. Going a step ahead, it could be targeted therapy, it could be immunotherapy. Now, it would be the specialist who decides whether you need surgery or whether your cancer can be managed by non surgical methods. In general, cancers of the mouth are best treated with surgery followed up by either radiation with or without chemotherapy. Whereas when you look at cancers which are affecting the voice box, which are affecting the upper part of the foot pipe, they generally tend to be more directed with preserving the organ. That means you want to preserve the voice, you want to preserve the swallowing function. So early cancers are generally treated by non-surgical methods. That means a combination of radiation with or without chemotherapy. If it's advanced, unfortunately, we are left with no other option but to surgically remove it and then back it up with radiation. Similarly, when you look at cancers which affect the thyroid, cancers which affect the salivary gland, in general, these are cancers which need to be first treated surgically and then the final reports are in detail reviewed and analyzed to see whether you would benefit by adding on other forms of treatment. Now, when we look at the newer emerging modalities like targeted therapy, immunotherapy, these always come into the context when you had a relapse of cancer. So, primarily remember that head and neck cancers always are treated by a combination of all the specialties. It's a common belief that when a person has been diagnosed with cancer, it's a death sentence. Friends, please remember, it's not a death sentence. It can affect any common man. It need not be with the use of any of the harmful effects of tobacco or any habits. Even a person who has had no habits can be affected by cancer. It's our duty to basically convince them that they need to get treated. Treatment can be extensive, treatment can be prolonged, but the caregivers and the patient, they need to understand that you can have cure achieved by proper treatment. Of course, the best chances of cure are when you detected the cancer early, because early cancer at early stage brings in the best outcomes. But health sciences and medicine has evolved so much that even with advanced cancers, we would never say it's a death sentence. So I think the basic message that needs to be conveyed here is that cancer has treatment and is potentially curable.